Okay, welcome, Andy, to my podcast. So
Hello,
glad to
Kyla.
have you here. I know that you are spending some time with your parents this weekend, and I really want to start my podcast getting to know a little bit about my guests. So I just wanted to know, what would Mr. and Mrs. Wilkins say it was like raising a young Andy Wilkins?
Well, that's an interesting question. A little Andy Wilkins. If I cast my mind back to when I was a child, I would say one of the things that characterised me as the eldest of four boys, so I had no sisters whatsoever, is I was very curious as a kid. I wanted to go out and I wanted to taste life and do lots of things. So I was quite musical. I played quite a few musical instruments. I was classically taught the piano and the clarinet, and then I taught myself the guitar and the saxophone. So I was in multiple groups and bands, loving making music. But I was also into sport. So I was playing cricket and basketball and football, and then I'd be out on my bike doing, because I lived in a small market town in the north of England in Yorkshire. So my life was full of activity and tasting life and getting involved in things and being curious, and just trying to get me home and into bed was difficult enough. My my father was a maths teacher, very logical, rational, but very intelligent man. I, he shaped a lot of my life, I think, because he was always inviting me to be curious about why things are the way they are. What is true really? People say things, but maybe 80% of what you hear is not really. So how do you distill the gold from what you're hearing, and how do you get curious about what lies underneath? And this sort of intellectual curiosity, this curiosity about tasting life and doing things. So I was a very active, energetic Andy Wilkins when I was a little boy.
Well, I would say you're still very active and energetic because you describe yourself as a futurist. You're a speaker, you're a podcaster, you're a researcher, you're a founder of a think tank, you're a director for an executive education program called Leading Systemic Innovation in Healthcare. So clearly, that curiosity and that excitement for life and that sense of wanting to be busy still carries with you today.
Yes,
Yeah.
yes, it does. Obviously, playing out on a slightly bigger stage now than I was as the
Right.
little.
Yeah, amazing. So I wanted to speak to you today because I feel like you're one of the leading thinkers on the future of healthcare. I don't just feel that, I know that you are a leading thinker, and I've been following your work for a number of years. And I really love the clarity in which you talk about health, healthcare, the future of healthcare. And I was wondering if you could explain to the listeners your philosophy on health and what it is, and also why it's considered a complex system.
Uh, hmm, that's a big question.
And
I,
that's the big
I'll
question.
s- I'll start. I'll build up to that if you allow
Sure.
me
Yeah.
to talk a little bit about my personal journey to encountering this and metabolizing it all and coming to the ideas that I've had. So, first 10 years of my life was nothing to do with healthcare, although I did study physiology and psychology and did flirt with being a doctor. I ended up in a rock band, and that didn't quite work out. Didn't become a mega rock star. So my punishment was that I had to get a job in British Telecom, which is very different.
It's a very
But
natural
it
transition.
a very natural transition. What was useful and valuable about working for a large corporate entity was to really understand what it's like to do work in those kind of organizations, the hierarchical structure, the silos, the transactional, metrics driven ways in which that organization was run. So it sort of allowed me to understand the machinery of how large businesses work. And I slowly worked my way up, and then I actually ran the messaging business in BT Mobile, which got me onto the conference circuit and was exciting new technologies, etc. And I had a lot of big clients who were big B2B clients. I used to go out quite a lot and talk to them. And one of the things that I noticed about our organization and more widely across BT is to how much we were pushing product. We had a sense in which we were trying to fit people onto the thing that I'm selling, and the features and benefits and the marketing was. What we weren't very good at was like down tools, go and listen to what value really means to those people, understand that more depth, and then come back and think about what it is that we should offer that speaks to what really matters, rather than trying to fit them onto our product. So I started to think more about what do we mean by value? Not value as in how much money we can make, but value as how does what we're doing make a real qualitative difference to the people we're trying to support? So I got tired of working for BT. It gets very political in large organizations. I'm sure a lot of your listeners will be familiar with that.
Yep.
I was picked up by one of the big strategy consultancies, Arthur D. Little, because there was a big boom in telecoms and all these value-added services were very important. And that propelled me into the boardrooms, which was fascinating to, what's the big picture story here around this? Where should we invest? Who should we invest in if we're going to do mergers and acquisitions? So it gave me another insight, not just to products and services, but how organizations think on the bigger scale. And then I did a lot of independent consulting after that across multiple industries, private sector, public sector, third sector, from banking and insurance to publishing and travel. That broadened my perspective and got me to see that all the things I'd learnt in telecoms, I wasn't just a telecoms guy. 70 to 80% of everything I learned, highly applicable in other industries. But this notion of what do we mean by value? This is like a golden thread that I was sort of building through my career. And as I was helping organizations understand what value means and how could technology augment and extend what they were doing, what I got to see is how difficult it was for traditional businesses to think like that. Usually you have a concept and an idea and you develop it up and you push it onto the market and you see what works.
Right.
What I was saying is, no, don't do that. First of all, go and sit with your customers and understand what it is that they're trying to do. And I eventually found a methodology, jobs to be done, as the great method for doing that. And what that very simple but powerful theory says that people don't buy or use products, services because they want the product or service. The products or services help that person or that organization get a job done. What are they trying to do? Who's trying to do it? What context are they doing it? What triggers it? What are the measures of success that doing that thing is being done in a practical sense, an emotional sense? How do I feel about it? And a social sense. How do I want to be seen doing this? This yields really rich insights. And if you capture that innovation and that insight and come back and share with the design teams, innovation goes from being 80% failure to 80% success. Because the principal reason why innovation isn't successful is not because we're not good at making stuff, is we never fully understood the problem we're trying to solve well enough. So we built and invested in the wrong thing, or we're busy bolting on or trying to extrapolate our broken offerings,
Right.
wondering why it's not working because we haven't spent the time to understand what value means and use that as the guiding lens to improve what we do. So that got me into products and services. And then I was wondering, why is it that organizations, even if they can do that once or twice, can't seem to be a natural platform for delivering experiences and services that really matter to people? So it got me to sort of apply the design thinking lens, not just to products and services, but to the entire organization. Why is it that organizations can't speak to that? And lo and behold, I found because we're hierarchical, we're transactional, we're siloed. Every part of an organization is delivering its thing, it's optimizing for its own local targets, and therefore creating value and working across silos to build something that really matters to customers doesn't. There's a sort of cognitive dissonance between that way of working and how leadership and resources are managed in an organization. So it really got me curious. Like, if we're going to create value at scale, we have to think about that. An organization, how do we create the organizational awareness and thinking to bring together the different parts of the organization in ways that can act more systemically to create real value and be able to tune into that and evolve and develop that over time, especially with new technology coming on? How do we do that? Then I guess about 10 years, 12 years ago, I came to health. And this question was then magnified on a giant scale, because what I got to see is when we look at health, what we see is not just silos inside organizations, but themselves are siloed parts of a whole health story. When you walk into a hospital, for example, you have an ologist for every organ in your body,
Right.
but no one who sees you. If we zoom out a little bit more and think about health more broadly, what we see, whether it's in primary care or up in the areas of prevention, or we're looking at mental health, or we're looking at any of the disciplines across the healthcare system, they all sit in their silos optimizing for their bits. And I was very fortunate to be a researcher and go out and do some research. For example, what are the unmet needs of diabetics? Let's go and sit with diabetics. What's it like to be you? Oh, yeah. How do people internalize being diagnosed? What sorts of life challenges they have to face, the psychological challenges of coming to terms with being a diabetic. What does it mean for how I engage with my family, with my social life? If I'm going to enter into a relationship, when do I bring up the diabetes? So what I saw is that when you think about health and how people engage with health challenges, it's not just the medical bit of glucose and insulin. It is the whole story of how people internalize their condition. What is it, the support that they need to live a life with diabetes is much broader than the medicalized model that we use. And lo and behold, 40% of diabetics end up in depression.
Right. Yeah.
We don't treat the depression until they're severe enough to warrant an intervention, and they maybe have to wait in a queue for 9 months for that. So lo and behold, up to 40 to 50% of diabetics are not adhering to their diabetic treatment, and therefore they get sick. So when you start adding all the bits together, you see we never truly understand what value means for a diabetic.
Yeah.
And what we've mobilized in support of them is a very narrow piece of a bigger story. So it got me thinking, we need to put humans and human experience at the center, because if we can't engage people where they are and with what they need, they will fall over, they will get sicker quicker, and they will represent as more demand. So making diabetes treatment more, if without taking into account these other things, is likely just to the conditions where more and more people are going to flounder because these other needs aren't addressed, and therefore they're going to represent as more demand, etc. So having done that research, doing it again in mental health and doing it again in patient experience, what was yielded to me was this sense that unless we see the whole person and their whole health needs as one integrated experience, we will be forever optimizing bits of their healthcare in narrow silos, looking at it in a myopic lens without seeing the bigger story. And as our population gets older and sicker and more multi-condition, we'll end up with more and more people bouncing around inside a system that can only see bits of them and can't see the whole person, never mind what they actually need in help to come to terms with their own condition and be the co-creators of their own health, because almost any health condition involves people needing to come to terms with it, understand it, own it, and do things in their own life, whether it's taking their medications or making improvements to their life or being available and engaging in the relationship with their healthcare professionals. So humanizing health, seeing it as a whole system, seeing value as the pulling together of all of those aspects into a shared story that can mobilize and support people more holistically has to be the way that we move forward in health. And that what that does is invite health systems to step out of optimizing parts and seeing the whole and coming together in a more systemic way. And it's off the back of that understanding that then led me to being commissioned writing reports and doing things which we can come on to a bit later, as how these insights then led to the kind of work that I currently do today.
So you not only see complexity in the healthcare system itself, but you are also seeing complexity in the people's lives that you're treating. You're seeing it in the communities in which they live, the social context. So I think when I thought about complexity in the healthcare system, I'm like, yeah, there's like so many moving parts and there's so many pieces of this system. But you expand that to think about like the complexity in people's individual lives as well.
Yes. Because whatever this thing called health is, that's the thing that we need to be optimal. So what does health actually mean? And once we've unpacked that, then we can look at what are the institutional structures and relationships and systems that we need to mobilize to speak to that health challenge. Because a lot of our health system has built or designed 50, 80, 100 years ago. And what we're trying to do is use a legacy model, which is largely a repair shop model. Look at most of the disease when, for example, in the UK,
You break,
the
we
NHS.
fix.
Yeah, you come and we fix you up and send you on your way. Now
Yeah.
we're in a world of long-term chronic disease and ongoing. So we can't use a repair shop model for an ongoing relational coaching model of how to help people with long-term conditions and chronic disease. So we're still trying to operate the old system in a new context that it's not designed for. I got very into the work being done by systems biology, which is basically the body isn't a bunch of organ diseases. It's one complex adaptive system. Your genes express into proteins, proteins into your microbiology, into your cells into tissues, tissues into organs, organs into you. You're one complex system all at play. But you are also an individual with, hopefully, education. You have behaviors that you undertake and choices that you make. So you're a cognitive agent in a living a life. So you're embedded in a which is embedded in an environmental context. So it allowed me to develop through this health beyond the fog, as I called it, a sort of systems biology view of health, which is I called cells to cities as and that all health is all of those dynamic nested systems of activity in the body from the sort of genes to you, but you're that's one complex adaptive system embedded in another one called life. And the stuff that you're doing and the decisions that you make, the stuff that you eat, the amount of stress that you find yourself under, or the lack of exercise, etc., all then creates the stressors that then feed back in to the genes, to the proteins, to the
Right.
cells, so that everything links together. It's one complex adaptive system nested in multiple levels. Seeing it out mapped out like that, knowing that information and data is now starting to pour in from all across that level, what we have is a bunch of organizations that sit like narrow silos behind that, just doing slices of that picture, actually unaware of all the others and certainly not working with them to understand the total picture. So this systems biology and the more information data coming out of it started to show that if we could see more holistically what's going on with an individual's life across all these areas, we could start to build a picture, a model of what's going on with that person. Through that, we can start to then create collective action of the people on the solution side to
Right.
be able to work as a system to speak to what we're seeing. Now we've got an attunement between the collective action of the actors and the collective complexity of the problem, and they can dance together and evolve together. So rather than having lots of silos doing to people, so how do we understand what's going on with people so that we can collectively act in support of creating either the direct support or the enabling conditions for greater health? And to your point earlier, when we look at sickness, we usually find, especially in a chronic condition, that the symptoms of sickness usually come around because either through lack of awareness or through stress in my life or the conditions I find myself in, I'm making suboptimal choices for how I'm living, which then creates the stressors that lead to ill health. That usually then is sat inside a social context. Maybe I'm in a dysfunctional family, maybe I've experienced trauma, maybe I'm facing isolation, maybe I'm a little lost in where I'm going with my life, which then makes me anxious, and then I drink more, eat more, do all these other things that then lead to the conditions. And then if you open the lens a little wider, environment have we created for our people? Is there a healthy food environment? Are there safe places to go? Are there facilities that people can convene and meet and live and flourish? Or have we created the conditions that compromise the social ability that then lead to the anxiety that then lead to the behaviors, then lead to the sickness? So it is all interconnected. So unless we see that as one system and act as one system, we'll be forever chasing disease as through our separate silos, failing to understand and be able to speak to the wider challenges of how we help our populations to live more healthily and ideally to flourish. So that's the kind of insight that I got about the complexity of the problem space, understanding that, helping us to think about how we orchestrate the complexity of the solution side of that.
Yeah, that's so fascinating. And as you're speaking, it makes so much sense. And at the same time, I think about the people that are working in healthcare systems or in government who are trying to usher in the future of healthcare or improve it, uh, being completely overwhelmed by the complexity or the considerations that they would need to make in all of these different factors, from individuals to communities to hospitals. It's very overwhelming. So I can see how people just retreat back to their silo, because that makes sense. It's hard, but it seems more doable. And so I'm really interested in different tools or frameworks or things that people can use to help them start having conversations at that level. And one of the tools that you and I are both interested in, and you've used more than I have, is this Three Horizons framework. And I just wanted to ask you why you've adopted this framework in your practice and how it's useful for you in kind of opening up these conversations with people that are working in system change spaces.
Yes, that's a very good question. And you're right to point out it is one of the primary frameworks that I found most valuable in the work I do to kind of provoke more bigger and systemic thinking. Uh, there are many reasons for this. So, one of them is because of the highly siloed, transactional, performance metrics driven ways that we do things. People's working experience and the sort of decision space they've got in order to make decisions is quite narrow. You've got to hit these numbers. You've only got this number of resources, and therefore people feel trapped in a sort of bureaucratic exoskeleton that doesn't allow them the room to maneuver, nor invite them to think about how we can do things better and different. How can we deepen our care to connect more deeply with people, to empower them to be able to look after themselves more and reduce future demand? It's usually about driving more throughput from the existing resources we've got, which narrows everyone, gets them back in this myopic space, which basically is pointing to that new ways of working bubbling up from the bottom meet the traditional silo transactional ways that the whole system thinks, and it doesn't know how to process what's coming up and therefore get back in line. Or no, that doesn't work over here because we've got a different way of doing things. And so a lot of these initiatives end up being stranded. So the dominant logic and squashes the very transformation that will help the system improve. So it's a kind of stuck in a kind of madness, if you like. Now, I think this moment in history opens up the opportunity for a new conversation, because across the world at the moment, we are faced in many, many countries with an aging population, with more chronic disease and more demand. And here in the UK, and I'm sure it's the same in Canada, depending on which economists you speak to, they talk about demand essentially rising between 3 and 5% a year. In the UK, we spend over £200 billion on healthcare, which is 40% of the entire government spend. And if we double that, we bankrupt the country. There's just no way we can do that. So the Treasury, where Mark Carney originally was supporting us in the Bank of England, is going, holy shit, like if we keep doing what we're doing, we'll keep getting what we're getting, and we'll end up driving the whole system over the edge of a cliff. So what I've been able to do is harness that to executives and say, take the model that we're doing now, like the top-down hierarchical, very siloed ways of doing it, and most of your initiatives about squeezing more juice out of existing infrastructure. But if we call this Horizon 1, the way we do things around here at the moment, and the thinking and the prioritization, the culture and the leadership, that all flows from that way of thinking. If we keep doing what we're doing, we'll keep getting what we're getting. And we're not able to address the fact that there's 4 to 5% increase in demand every year from an older, sicker population, because what we're doing can't speak to that bigger challenge. All we can do is make what we're doing a little bit more efficient to treat the people coming through the doors, but we're not stopping why people come through the doors. So if that demand increase, we're going to be overwhelmed. So if our innovation aspiration is simply to tweak and squeeze more juice out of our model that isn't working, we are taking a decision in the long term to drive our system over the edge of a cliff. So if we keep doing what we're doing, we'll keep getting what we're getting, and bootstrapping a broken model will not get us where we need to be. Agreed? Most of them will go, yeah, okay. Okay, what would a system need to look like to address the public health challenge we see in front of us? Yeah, we go upstream. What is it that's causing the ill health in the first place? What could that future system look like that could really speak to that? Horizon 3. What would need to be true about that system? Oh, we need to collaborate across silos. We need to share information. We need to move budgets around a different way. We need to have longer term planning and investment cycles. We need to be more adaptive and innovative. We need to use more technology and share information and adapt. Yes. Okay. So how the hell do we get from Horizon 1 to Horizon 3? This is the Horizon 2, which isn't about bootstrapping a broken model. It's about bridging us to an entirely new model that we've just agreed would be the
Better.
superior way of addressing. So our challenge is, how do we bridge to that future, not how do we squeeze more juice out of what we got now. Yes, we need to attend to Horizon 1. We can't ignore it, but we need to bridge from that to Horizon 3. And so landing that with senior executives, it's like it enables them to break frame, enables them to go, you're right, no amount of fiddling with the furniture of now is going to get us to where we need to get. We need to think bigger. We need to think about how we manage a transformation from silos to collective systemic action that's oriented towards addressing the scale of the challenge that we see. That has been the approach that I've been able to bring to life, not just in theory, but in one of the integrated care system regions of the UK, where money was diverted to a local region to pool its actors together to address the population health. We ran that Three Horizons program, bringing hospital leaders, council leaders, primary care leaders, social care leaders, mental health leaders, and third sector leaders all into the same room to have this Three Horizons conversation, to
Wow.
basically challenge them. Is our future just going to be polishing each of our silos to do a little bit more? Or are we going to come together and build a systemic approach that takes the best of what we've got and integrates them at a higher level to a system that can really speak to the needs of our population? Yes, we want to do that. Okay, how are we going to do that? We're going to need to work together as a system. So well, if people are interested, Future Shift, Suffolk and Northeast Essex. If you check that online, you'll see
Okay.
the documents, the reports, the workshops, the videos that got hospitals, councils, primary care, third sector to all move from a bunch of eyes bouncing off each other to a whole collective system of we. And we branded it Can Do Health. And let's not use our traditional bureaucratic ways as excuses not to. We're all active participants in a shared story for our population health. And through innovation events, running events across the whole system that brings all these actors from different businesses and different public sectors together to celebrate success, to show what we were doing, enabled a new collective energy to make a real difference. And Suffolk North East Essex became the highest performing area in the country, not because it had better technology, because people were coming together, breaking out their silos, talking to each other, understanding collective challenges and working together in new ways. And this is the energy, this is the thinking that takes us out of the old way of doing things, transactional, siloed, to collective coming together to share work around the shared challenges of the health of the population, the areas we serve. And of course, every area will have slightly different variations. If it's in a city or rural, there's a different dynamic and a different set of actors. So this is always dynamic and context dependent. But the Three Horizons gives us a nice framework for shifting the debate from optimizing what we've got to coming together to reimagine what a shared future could look like and how we can collectively as a system move towards that.
And how do you find the conversation shifts in terms of um, people sort of coming together around that common purpose as opposed to being scared or worried about the loss they might experience in that shift, whether that be a loss of autonomy, a loss of roles, a loss of decision making? Does that come out in that conversation, or does that happen later on in the process as people take Horizon 2 back into their workplaces?
I think some of those questions probably come a little bit later, but
Okay.
there is a fundamental reframing that this Three Horizons approach takes. And most parts of the system will be under some sort of stress, worried about their future, sort of slightly disoriented or in some sort of crisis. So in some ways, coming together to have a positive story about what we collectively could do to support the people we're here to serve is a very inspirational and it's sort of exciting way of transcending the stuff that we do now and see ourselves participating in a greater, bigger story. So most people, if they care, maybe they just care about their bottom line and don't want to play, but if they do care, this is an invitation to participate in something better, something bigger, something optimistic. Then the questions come, well, what does that look like? What are the Horizon 2 initiatives that we can participate in? But having that shared story of what we could become, then the space from which people can start to do these, start to think about what are we going to do and how are we going to do it. If we don't have that Horizon 3 story that invites the sort of collective ambition we have, of which there's some initiatives we can get going today, but we're building towards something where we're both going to win.
Yeah.
So that's a much more exciting story rather than who wins, who loses out today's budget by doing this. All the conversations get stuck at that horizon.
And who's going to get the money?
level.
Who's going to get the contract? Who's going to get the whatever? You lose the forest for the trees, I guess.
Yes.
Yeah.
Yes.
Yeah.
So it becomes a scalable language for getting us out of the transactional oil and water problems that we have, trying to get stuff of cooperation, to lift it up a level and say, what's our shared story here? And how could we both win and the patient and the public win from this? What does that look like? What would need to be true? Okay, it's that. Now we've got a common language that transcends the site. So how do we build that? Horizon 2. It becomes the shared story that can galvanize the energy and the will and the excitement to do something better.
Yeah, and that's what I really love about
we
this.
Need it.
Yeah, this model is so interesting to me because it's quite simple. It's actually quite simple. 3 lines is all you have to draw on a board. But you can have that conversation with your team, with the team that you work most closely with the organization that you partner with a lot, to a regional conversation, to a conversation with the community, to different levels of government. Like, it is something that is a common language that could be shared in terms of talking about the future and the steps we need to take to get to the future at many, many different levels. And I think there's something really powerful in adopting a system-wide approach to thinking and talking about what the future looks like and how we need to get there.
Yeah. How do we go from lots of silos, self-interested in their own preservation performance, to a shared story of we as a system building something better than we could have done individually? There's one thing I would add to this, because although the framework is easy, experience has shown that Horizon 1 is a very powerful governing logic. And even if people have gone through this process and go, yes, we need to, Horizon 3 would look like that, we need to do these kind of transformations. When they get back into the trenches, Horizon 1 is calling. Horizon 1 needs you to deliver these metrics and these numbers in this particular way. So often Horizon 2 can be co-opted by Horizon 1 back in service of itself. So even though framework is simple, actually holding that and being true to it is not easy.
Right.
And one of the tricks really is that Horizon 1 will have priorities that people do need to attend to. We're operating in real time with real people coming through the doors and we have to deliver service. Can we look at the challenges of Horizon 1, not through bootstrapping and therefore and reinvesting in deepening Horizon 1, but can we look at some of the challenges that Horizon 1 is showing up and think, is there a Horizon 2 way of solving that? So we can address some of the issues now, but in a strategic way that builds the capability to get towards Horizon 3. So how do we get smart and clever about how we solve the problems of today in a way that lays the foundations for tomorrow? And that's where the clever thinking from people on the ground is going to be really, really useful. But if you haven't got that Horizon 3 and Horizon 2, then you won't be thinking that way. Yeah. So this is like particularly improving what you do in a strategic way. This is where it gets clever.
Yeah. So I'm trying to leave listeners with a couple practical things that they can take away after listening to this podcast. So what's something that people could do this week, next week, as leaders or system improvers to start shifting themselves into a different way of thinking or a different way of being in their work?
I think there are a couple of things. One is coming back to this question of value. What are we doing? Do we really understand what matters to the people that we're caring about? Have we done that thinking? Can we go and talk to them if we haven't got that information and build a deeper picture about What is it like to receive the services that I'm offering? And what are the insights we can get that help us locally to shift and change and explore and get the confidence of being able to tune what we're doing to what really matters? Some of that may need money. Some of it doesn't. Some of it just needs to be a wiser, more lean in and listen and understand what matters to people in a way that allows us to reconfigure what we're doing and start to stretch those muscles of delivering what matters, speaking to what value really means to the people that we serve. I think where we see there's opportunities to work with others and it's not happening, how do we break out of our silos? Go and speak to the silos that sit alongside you that you know you could be working with. Go and sit in and give presentations to them on what you do and why you do it. Get them to come to your team meetings and tell them about what they do and how they do it. So this mutual understanding of each other's worlds starts to give a shared understanding of what's going on here. And out of that shared understanding comes new opportunities to do things differently that you wouldn't have seen if you just sat in your silo doing your thing, getting irritated that they don't do that because of whatever reason. So sharing the information with each other about what each other does creates a common understanding of the space that we both inhabit, of which new opportunities will arise. So I think there's real wonderful opportunities to start flexing these muscles from the bottom up. I think if you're working higher up in the system as a system leader, I think this question of if we keep doing what we're doing, we'll keep getting what we're getting. Are we willingly participating and perpetuating a model that we know cannot sustain itself? And can we be honest about that? Can we create some space to facilitate a systems conversation about where are we going and what are we doing? And this is where facilitated workshops that I run and others do as well. I'm sure you probably do so as well. Bringing systems leaders to have that honest conversation, to explore futures, to check where are we all sort of willingly participating and perpetuating a model that is probably kicking the can down the road.
Right.
Because I would argue right now is the moment we need to start looking at this in a systemic way. Because A, it's not sustainable. P, are getting burnt out. P, the population is getting restless. So unless we got a story for them, then I think we're in danger of creating a level of breakdown of trust institutionally between the public and the services that they most value, health. And D, we've got a whole revolution of AI coming into this space and technology revolution. So this technology revolution is an enabler, if we choose to use it in that way, for a new way of working, a new way of being. But if we haven't had that conversation about what that new way of being means, we'll end up using all this amazing new powerful technology and superpowers, a broken old model. And that would be collective insanity.
Yeah.
So systems leaders, now is the time for this conversation.
Amazing. Yeah. Thank you so much. I think our conversation is really timely. I feel like with the pace of AI and the discussion about technology, we're at a real crossroads right now of whether we're going to use this advancing technology to keep us in Horizon 1, or can we use it to shift us into Horizon 3 and use it as an enabling factor for getting us into that future? And if we don't start having those conversations now, we're not going to have a choice in it. It's just going to happen.
Yeah, the way I frame that is, are we going to use this technology to digitize what we do, which is the old legacy, or are we using this opportunity to use this new superpower of digital and AI to reimagine what we do
Right.
in a digital AI world? And have we done that reimagining? Because if we put it to work, bootstrapping a broken model, we are willingly participating in an enormous lost opportunity. What is this reimagination? And so let's think systemically about what we could be doing to address the challenges that we all face. What new ways of working does that call upon us to do, and how might AI be an enabler in that? That's a much more exciting and rewarding and fruitful conversation to be having as system leaders.
I agree. Well, thank you so much for taking time out of your day and your time with your parents to speak to me today. I really appreciate it. And I look forward to having you back on the podcast in the future.
Thank you very much, Kyla. These are exciting times. So hopefully your listeners will find some value in this, and we'll keep the conversation going because there's so much to talk about.
Absolutely. Thank you, Andy.
All right. Thank you so much.